in the thick of the holiday season. It's supposed to be a time to celebrate, but so many Americans, 30 million Americans who suffer from migraines, you know, it can be a hard time. It can be stressful, and this season is filled with migraine triggers. Here with more, Dr. Louis Ziegler. He is a physician at the Advanced Health Center in Arlington, and you come here bearing gifts that we're going to get to here to talk about things, but let's talk about triggers. And the holidays bring a #1 trigger, and that's stress.
You're correct. You know, holiday season's supposed to be fun, but of course those migraines can really be unfortunately painful. They can last sometimes 4 to 72 hours.
Wow. And like a lot of my friends who have these, they need a dark room, you know, no lights, no noises to just get through it.
Well, there's two types of migraines. The first being the classic migraine, right? That's with the aura, where they see spots in their eyes, they get dizziness. And the second migraine is the common migraine, where they have nausea, possibly vomiting. So those are the two primary types of migraines.
You say to get through this, limit some stressful situations. And the stressful situations that you're talking about aren't just the regular ones we would think about. You're talking about shopping.
Correct.
Walking through the fragrance aisle at the department store. Talk to me about this.
You're correct. What happens, you know, during the holiday times, these triggers, we have different types of smells, lights. Those lights can be extremely bright for people, so we have to limit our times in those shopping malls. Sounds, smells from the perfumes, again, a trigger. We want these holiday times to be a nice time, but we have to limit the amount of triggers. So we want to give people really helpful tips so they can understand to decrease these triggers and get them feeling better. Basically 101 of migraine treatment. Yeah,
some people like the smell of the fragrances walking through all together, but others can't hack it.
Right, and you have to limit your time in the mall smelling those new scents. And any type of sensitivity and changes can really be a trigger for a lot of people. So limit your time. I mean, really, you know, be aware of your environment. Limit the time in the malls. Also, limit your time shopping on the computer. Watch your posture. If you're typing on the computer, it can strain your neck, causing muscle tension.
Yeah, I was about to say, limit the mall time. People do the online shopping, especially this week with Cyber Monday and the other days that are coming up. But looking at that computer screen could be another trigger.
Correct. I mean, when they start to really push their head forward, it causes like a turtleneck. It puts pressure on the disc, causing those nerve roots to get really irritated. That trigger, again, causing headaches, nausea.
The light from the computer.
The light from the computer, you're correct. So again, limit the amount of time that you're spending on the computer shopping.
Let's talk about what we eat, and salty foods is on the list.
Foods, yes. MSG, Chinese food, high. That type of sodium, again, we're trying to make our taste buds enjoy the holidays, but you have to be careful with the foods. There's another culprit called taramine, which is in foods that are aged, such as aged cheese or meats. So we have to be careful about this culprit. For people who don't really eat a lot of that, that can be a major trigger. So be careful about the food.
Nowadays, holiday parties almost every weekend, Wednesday nights, Thursday nights, whenever. And people are going to a lot of these, and at holiday parties are the things we want to eat but shouldn't.
You're right. And it's the food and the alcohol, sugar, also gluten. Be careful. I mean, limit your type of exposure to all these. We want to make your holidays an enjoyable time. So again, we have to limit it. The alcohol, there's tannins in those, sulfates in the wines. But the tannins, especially the red wines, can be a major trigger for a lot of women. Women suffer 3 times more than men, but migraines affect men, women, and children.
Yeah, not fun for anybody. What'd you bring here on the table to help us?
So we brought some types of management tools to help people with migraine triggers. We want to talk probably a lot about something called magnesium.
Okay.
Magnesium helps protein synthesis. So if we're going out to a holiday party, you can take some extra magnesium. I like magnesium citrate. About 300 milligrams are helpful.
So take it before, so you won't be paying later. It could actually help you.
It can actually help you. It can decrease those muscle tensions. Magnesium citrate will relax the muscles, make you feel more relaxed. Magnesium is a key mineral. A lot of people are really deficient in magnesium, so I like this to be supplemented.
And a lot of people think of it afterward. You get the pain, and then you want to solve it with drugs, rather than trying to do something before it happens.
Proactive, right. And that's why, you know, prevention is really great. To really try to get in front of this. Limit yourself. Watch too much time at those holiday parties, too much alcohol. Prevention is key.
Doctor, we're running out of time, so name the other couple things real quick that you have here.
Oh, great. I like the B vitamins. B vitamins helps the ATP of the cell.
Okay, B vitamin. Okay, and the next one?
We can talk about acupuncture. Acupuncture is a great migraine relief. There's points that we can use on our own hand we call large intestine 4. I like acupuncture being it as a migraine treatment.
And last one, the pills that you have on the side, what are those?
CoQ10, about 100 milligrams of CoQ10. It's neurological. It's going to help, again, the mitochondria of the cell. Again, really good for migraine treatment.
All right. Thank you so much. I know a lot of people can use this information. Thank you. Up next on the show, we're going to tell you about a pop-up shop in the heart of Georgetown that's here for just 1 month. That's next.